Hi, I am Araz Massraf, one of the orthopedic surgeons in Peterborough and also work in Kettering, Woodland Hospital and Fitzwilliam Hospital. I've been asked many times as a hip surgeon and a knee surgeon some questions, and I would need to answer these questions to my patients all the time. And I thought would be the best thing to make a video and make like a universal answering of these questions, which will be in the mind of our patients whenever they go and for a hip replacement or a knee replacement. One of the questions, can the hip replacement can happen in any age? Yes, it can. It depends on the genetics of the patients. Some patients come to us as young as 20 years old for a hip replacement. So there is no age boundary. However, the most important thing about hip replacement, we need to tell the patient that this operation should last you for a lifetime, if possible. But if you come in a very young age and you're overusing your new prosthetic hip, then that will be unlikely. The advances in hip replacement, trying to find out a better link between the bone and the prosthesis to prolong the life of the prosthesis, which means if we are doing this operation in young patients, they can last for 40-50 years, and that's the aim for it. Revision surgery after a hip replacement is not a disaster, but it will be better to be avoided, because every time we do a hip replacement or revising the knee or revising the hip, you're losing bone, and that's not a good thing for the future. And the latest advance in the hip replacement is we are carrying on with the traditional hip replacement which we carried on before, and we cannot change much on a hip replacement because we will not know the outcome of it in the long term. So what we need to do, we need to carry on with what we have, because we have at least 40 years of a follow-up, and we know the survivorship of these 40 years. We're trying to improve the link, as I said, between the bone host, which is the patient, and the prosthesis, and trying to make a better link last longer. And that's the whole aim of surviving of the prosthesis, to make it last longer. Hip replacement is one of the successful operations in human history. It's one of the operations when the patient from pain, let's say 8 or 9 out of 10, it will go down to 0 sometimes. So imagine the benefit of that for the patient when they have a pain day and night, affecting their sleep, affecting their walking, affecting the daily activity, and then suddenly the pain disappears. So if the patient asks what kind of preparation I have to do for a hip replacement, I always say there is not much preparation. But if you have a high BMI, you need to lose weight. It's a weight-bearing joint, so the best thing is to have less weight going through it. To go back to my first point, the surviving of the prosthesis will last longer if there's less load going through it. Just like imagine a car tire. If you are using the tire for day and night and doing a lot of mileage on it, you need to change that tire more frequently than the one which you keep it in the garage overnight. So this is the same principle apply here. And the preparation, as I say, weight loss, healthy diet, exercise if you can, because sometimes you can't. There is no much movement in the hip joint. So there are limitations for that. And keep it healthy. If you're diabetic, you should be under control. High blood pressure should be under control. Taking oral medication regularly, and make sure you are fit for the surgery. After hip replacement, patient asks about recovery. And I always say the following. It's a big operation. It takes 3 months overall to overcome the operation. 6 weeks will be on crutches. Your leg will be swollen for up to 6 weeks to 8 weeks, and that's normal healing process. because also we give you anticoagulation to prevent clots in your veins, and that will add to the swelling. So the best thing is keep it elevated, keep exercising, and keep going, and follow the instruction regarding the prosthetic joint to prevent any dislocation. And healthy diet, as I said, to carry on, and the wound will heal. Once the wound healed, then you need to carry on with the next step of the preparation, which is getting rid of the crutches and start to walk upright independently and back to normality again. With the limitation, you should carry on like crossing legs or picking up things from the floor for a bit more time, 6 months to a year, just to let the muscles to become stronger, tissues to heal properly, and the prosthesis find a way inside your body to become part of your body. Thank you very much.